Okay, so today we're going to talk about holter monitoring. The holter monitor is a non-invasive method to monitor the patient's heart rate and rhythm over a 24-hour period. We widely use this for patients who present with a chief complaint of palpitations or syncopal episodes, which is when the patient passes out. The monitor is about the size of a portable cassette player, or some of the newer models are the size of a deck of cards. The patient's heart rate and rhythm are recorded for a 24-hour period, and that's for the adult patient. And pediatric patients typically wear the holter monitor for a 48-hour period. And that's just due to them being more active and because of all the interference. So the patient's skin should be free of any oily substance, lotion, or powder. We shave all locations where the electrodes will contact the skin. Rub and clean the electrode site aggressively with alcohol to remove dead tissue cells, body oils, perspiration, dirt, and creams. Abrade the electrocytes using 2x2s or 4x4s. So we use the gauze to do this, or some places they look like little pieces of sandpaper and they stick to your finger, and that's what you would use to abrade the skin. So you are going to get redness on the patient's skin. And then we use the highest quality holter electrode possible, and we select flat areas over bone on the chest, avoiding large muscle areas and avoiding adipose tissue as much as possible to minimize the interference. So after we prepare the skin, the electrodes are placed, and sometimes once the leads are attached to the electrodes, they will tape down over the leads so they don't fall off. A cassette tape is placed into the recorder. A new 9-volt battery is placed into the recorder, and prior to doing this we will do an initial 12-lead EKG. So you'll do an initial 12-lead EKG, and then you will prepare the skin and attach the electrodes and the leads for the holter. So the patient will be instructed to record any abnormal feelings in a diary, and they should be instructed to continue their normal routine with the exception of taking a shower or swimming. We do tell the patients to try to sleep on their back or any position that doesn't cause tension on the wires, so that avoids any interference. And the patient should also be instructed to stay clear of electrical blankets, magnets, metal detectors, and high voltage power lines, because that can affect the recording. So there are 4-lead, 5-lead, and 7-lead wires placed on the patient's chest during the monitoring. They are taped down, and the patient is instructed not to wash that area for the 24-hour period. So some clinical sites do have 4-lead halters. In lab, we have 5-lead and 7-lead halters that you will be practicing with. And one of them is the size of a cassette player, of a Walkman, and it does have the cassette tapes and the 9-volt batteries. And then we do have our 7-lead systems are smaller, like the size of a deck of cards, and those actually have like a camera chip in them instead of the cassette tape. So here's a picture here of a 7-lead holter, and this is the one that we actually have in lab. So you can see the size of this is smaller. And then here's a newer 5-lead holter monitor, which is also smaller than the one that we have in lab. So for 5-lead placement, and the most common are 5 and 7-lead monitors. For our 5-lead placement in lab, the red lead is mid-sternal area at the level of the second intercostal space. The green lead is the ground electrode, and that's to the left of the patient's sternum at the mid-clavicular line at the level of the second intercostal space. The white lead is at the level of the 5th intercostal space on the patient's right side. The black lead at the level of the 5th intercostal space on the patient's left side. And then the brown chest lead is the center of the chest at the level of the armpits. And yeah, it does say this in your textbook too, to please remember that lead placement varies dependent on the type of halter and dependent on the manufacturer's recommendations for lead placement. So this is the lead placement that we will do in lab with the type of Holter monitors that we have based on what the manufacturer recommended. But just take note that when you do go to clinical and you do have a 5-lead Holter, it might be different than the one that we're practicing with in lab. And this lead placement, this picture here, it may be different. So when you go to clinical, you of course do lead placement as they tell you to do so. But in lab, this is how you will do lead placement. So the red lead is located in this area, the green lead, and then you have the white on the right side, black on the left side, and then the brown is in the center of the chest. And then for our 7-lead placements, for the 7-lead monitors that we have in lab, red is 4th intercostal space at the left border of the sternum. White is left clavicle lateral of sternum border. Brown is 6th intercostal space at the anterior axillary line. Black is the right clavicle lateral to the mid-clavicle line. Orange is the 6th intercostal space on left mid-clavicular line. Blue is the manubrium sternum, so top of the sternum. And green is lowest rib on right side of chest. And then here's a picture of this placement. And again, remember that lead placement varies depending on the type of Holter and manufacturer's recommendation. So the black and the white and the blue, and then here's a picture on an actual patient, and then the red, and then the orange, and then brown, and then the green is located on the right side. So again, there will be 4, 5, 7-lead wires placed on the patient's chest during the monitoring, and they typically are taped down, and the patient is instructed not to wash that area for a 24-hour period. So the patient diary, they will be giving, it's just typically a sheet of paper or a trifold pamphlet that the patient can write the time of each event, what they were doing at the time, the symptom they had, how long the event lasted. And then an example is January 15th at 12:34 p.m. They were walking up the stairs, their heart was pounding, and it lasted about 1 minute. So there is a clock located on each Holter monitor, and the patient should use that clock. And we tell the patients to use that clock for obvious reasons. We want the time that they're having the symptom to match up with the time that we see on the monitoring report. So when we're scanning through the 24-hour period of EKG rhythms, we need that time to correlate with the time on the rhythm analysis. So some hospitals do ask the patients to keep a more complete log of events, and some hospitals don't ask the patient to keep a diary because typically some patients forget. But here's just 2 examples of a patient diary. This one is just one sheet. And they write in the date, the time, the activity, and the symptoms. And then this is another patient diary. So they put the patient's name, age, address, medications. They put everything on the front of that diary, and then they open the page to put in the date, the time, the activity, and the symptoms, and how long that lasted. So removal of the Holter monitor, remove the monitor electrodes from the skin as you would a Band-Aid. We tell the patients if they would like to remove them, that's fine as well. Turn off the monitor, take out the cassette or the camera card, remove the batteries, clean the electrodes and the wires, and clean the Holter. And then ask the patient if they had any events while being monitored. And then they attach the diary to the tape or to a camera card so that the scanner can review all the material. And then this is just a picture. There is typically someone dedicated to this area that they would sit at the computer and they would scan through on the computer the 24 hours of material. And this is a picture too of a scanned Holter. I also have on D2L, I have 2 examples of a scan. It's not the entire 24-hour period of the scan, but at least you can see some examples, and I can go over those in class. Event monitors, just so you know the difference. This only monitors the heart's electrical activity when the patient presses the event button. So on the Holter monitors, on some of them, you will notice there's an event button. So it isn't a continuous recording of the patient's heart rate and rhythm like the Holter monitor. It only records when the patient is feeling chest pain or shortness of breath, and then they press that button. So in lab, you're required to pair up with a partner or a group and practice 5-lead and 7-lead Holter placement. Each student should perform a total of 6 Holters in lab prior to your final test out. And then the practical final will be on 5 and 7-lead Holter placement.